Okay, and the recording has begun. Welcome and thank you for joining us. The Global Health Institute, in partnership with MESCOP Global Health Programs and the Global Health Alliance, is excited to welcome you to the Global Health Speaker Series, showcasing the multidisciplinary aspects of global health work and research. I will hand it off to Sarah from the Global Health Alliance, who will do the honor of presenting today's speaker.
Good afternoon, everyone. I'm Sarah Yao, a PhD candidate and a member of the Global Health Alliance, a student-driven organization aimed to enhance students' knowledge of how public health functions in a global context. We'll have a Global Health Alliance interest meeting next Friday, so if you'd like to share your experience in global health and find the ways in which you can better engage, please join us. It is my great pleasure to introduce today's speaker, partnering with GHI. Tina Samsamshariat is a fourth-year MD student at the University of Arizona College of Medicine, Phoenix. She completed her MPH at the University of Southern California and has more than 5 years of global health experience through clinical training, public health training, and research training. She was also a 2021-2022 Forgadi Global Health Scholar with the National Institute of Health based in Lima, Peru. She collaborated with local non-governmental organizations, the Ministry of Health, and the Pan American Health Organization to build her fellowship project. And she's very much interested in global health equity. Let's welcome Tina.
Hi, everybody. I'm Tina. Thank you all for coming. I'm just going to go ahead and share my slides and we'll get going. So thank you, Sarah, so much for the introduction. I'm Tina. I'm a fourth-year medical student at University of Arizona in Phoenix, and my presentation is kind of my story, my project as a National Institute of Health Global Health Scholar, and kind of some pearls I learned along the way and the methodology I used. So this is kind of just a brief outline of where we'll be going and just kind of starting general, getting into the project, and then kind of my conclusions and my lessons. So a little bit about me before we get started, so you know who I am. I'm by no means any type of expert in anything. I grew up in Southern California in San Diego. I did my undergraduate at UCLA. I got a Bachelor in Science in Human Biology and Public Health. I then went to University of Southern California for my master's in public health, where I focused in global health. And then I ended up at the University of Arizona for medical school. And kind of throughout my whole education, global health was a huge connector. And whether I was at UCLA, where I did, these kind of medical mission trips, or USC, where I did kind of bigger projects, and then at U of A as well, global health was always a part of my education, something that I was super passionate about, something I knew I wanted to do early on, and kind of a reason why I am in medical school. So kind of, I'm going to put some pearls. They're pearls I've learned through my global health learnings, and discussion points we can have after. So the first pearl I have for you guys is that global health is not health. And this is the definition, I'm sure a lot of us have seen it, that was published in the Lancet some years ago, kind of talking about like what actually is global health. When we come together, what are we talking about it, and what's our goal? And it's basically talking about how it's many disciplines within health and beyond health coming together to kind of promote population care. So, when we're talking about global health, we're talking about economics, we're talking about human rights, we're talking about sociology, we're talking about business, we're talking at the local level and the national level and the multilateral level. So I think when you're framing projects and you're framing questions, kind of looking at it through the lens of everything else is really powerful. And like where the economists might care about health, right? Because like, oh, if you have a healthy population, then you have a healthy workforce, and then therefore our GDP will go up. The global health person will kind of pull in economics within the framework of health. So I think just having a working definition as you move forward in global health is huge, and this is the one I like to use. So I am a 2021 to 2022 NIH Fogarty Global Health Scholar. So the National Institute of Health is kind of you have the office of the director, and then that's broken down into several other offices. The Fogarty International Center is its own unit, its own center, with its own funding, probably some of the least amount of funding that the NIH gives. As compared to some of the other offices. So the fellowship is through this center. They fund fellows, both pre-docs and postdocs from the United States and other countries around the world. And the Global Health Equity Scholars is the fellowship program. And it's basically divided into consortia through the country. So GHES is the consortia that includes U of A, it includes Yale, it includes Berkeley and one other school that's I can't think of now, but and then you work within the consortia to kind of build your project and make your connections. So that's a little bit about the NIH and the fellowship. So my fellowship project, the title is Escuchen mi voz, or Listen to My Voice. And it was a collaboration, not only with the NIH, but with Mamás del Rio, which is a local non-governmental organization that works in the Amazon that I'll get into a little bit later, with the University of Arizona, obviously, and with the University of Cayetano, which is one of the kind of big top universities in Peru. And then I had a ton of collaborators that this project would not be possible without them. So let's get into it. So a little bit about the background of my project and how I got to my question and where my methodology comes in. So the first case of COVID was recorded in Peru in March 2020. They very quickly, like I think less than 2 weeks after, kind of shut down, and they went into kind of shutdown mode of the whole country. By 2021, Peru had proportionally the world's highest death toll in the world. And this was kind of hitting news globally. And, you know, we think about data being unbiased, but it's very much biased. And so how our country's reporting data and numbers and indications is huge. So this was breaking news. Loreto, which is one of the regions of Peru, which I'll talk about a little bit later too, was one of the hardest hit regions. And why this is important is because Loreto has the highest number of indigenous communities in Peru. So we're already talking about equity, right? And then unfortunately, the regional health system in Loreto collapsed secondary to the pandemic. And when I say collapsed, I mean health centers closed because they didn't have the people, they didn't have the training, and they didn't have the equipment to handle the pandemic. So this was published in The Guardian in June 2021, this headline in this picture. And what you see is mass graves in Iquitos. Iquitos is the capital of Loreto. It's very much a tourist destination if anyone's ever been there. And they just unfortunately could not handle what was happening. And there's a road there, and there was just mass graves along the road, and really, really sad. So here is just headlines from the New York Times, from Reuters, from NPR, kind of about what was happening in Peru last year. So a little bit more about Loreto. If this is, you know, the whole country of Peru, Loreto is in the northeast region. It's an Amazonian region, so you're bordered by Colombia, by Brazil. It's one of the poorest regions in the country, poverty rate of between 36 to 40%. And then the Loreto itself is further divided into smaller districts. So if you think of Loreto like a state, like you would think of Arizona as a state in Peru, and the districts being counties, there's about 53 of them. And then over a third of its population lives in rural centers. And this is important because these population centers, these rural centers, are not connected by land. They are connected by a river system. So you can't drive. You have to either get to communities, get to these areas via boat through the Amazon River or tributaries of the Amazon River, or by air, right? Like helicopters or planes. So there's a lot of naturally isolation between communities, just because logistically travel is quite difficult. And so when you think of a pandemic like COVID entering this, you're like, okay, well, how does it really enter? Well, there's a lot of trade happening, right? Like up and down the river, you're selling fish and coming into the high population center to sell your goods, and then you go back to your community, and whatever you might have acquired in the city you take back with you. And then now when you take something like an infection back with you, it gets trapped in that community. So then it can spread really fast within the community. So I partnered with Mamas Del Rio and my mentor. So the way NIH works is you have your in-country mentor, your LMIC mentor, and your US mentor. My US mentor was Dr. Purnima Madhavanan, and my Peruvian mentor was Dr. Magali Blas, who I see on the call. So you guys can also probably ask her questions at the end if she will take them. And Mamas Del Rio is an organization she started, and it's a community-based maternal and neonatal health program that is through the University of Cayetano. And the goal of the organization is to kind of promote neonatal and maternal health through the training of community healthcare workers. So community healthcare workers, there's one community healthcare worker per community. And what Mamas Del Rio does is they use tablets, they use technology. So the community healthcare workers can follow up with moms during pregnancy. They visit the moms about 7 times and they educate them and they take their blood pressure, and the community healthcare workers are trained in understanding like what's an emergency in pregnancy and who's the person I need to take to the health center. So what was interesting and what really interested me, and this comes from surveillance sampling that Mamas Del Rio did, was despite the collapse of the health infrastructure during the pandemic, these community healthcare workers were still making home visits. About 2/3 of them were still visiting pregnant moms and providing some care. So you ask yourself, oh, like, okay, so when the formal health system collapses and now we're relying on community health and kind of foundational health, like how do we make that system stronger? So kind of my objective and the principal objective of my project was understanding how the COVID-19 pandemic affected the life and work of community healthcare workers or agents. I'm going to use those kind of synonymously during my presentation, from indigenous communities in the Peruvian Amazon to in order to better utilize community healthcare workers in future health disasters. So like any good qualitative project, I have a vague principal objective. So anything I find out is part of my principal objective. I did have a secondary objective. It was using semi-structured interviews to kind of understand factors that promote COVID-19 vaccine acceptance and hesitancy among indigenous communities in Peru. I won't really get into the interviews and the findings, but if you guys have questions at the end, I'm happy to answer about what I found. Vaccines did get to the communities. They got there slow. Like here in the US, there was a lot of hesitancy around vaccination as well. So pearl number 2, how to get involved in global health at the start of your career. So for me, I think a good way to think about it is picking a region or an issue. So I knew I wanted to be in Latin America. I had been to Peru before. I knew I wanted to go back. Like for whatever reason, it was my calling. I wanted to go back to Latin America. But for others, it might be, you know, I'm very much passionate about women's health, or I'm really passionate about tuberculosis. So then you kind of pick your issue, pick your region, and you go down there. Another thing to think about global health is that it is very much a small world. Everybody knows everybody. So making connections sounds scary, but it ends up being quite easy because like you're like, oh, I'm interested in women's health. Well, now global health is even smaller because the people that do women's health in global health is few comparatively. So it's easier than you think. Research is a great place to start. I mean, right, we're all at the and like public health world. So research is kind of an extension of the field. But even if you're not passionate about research, it's a really good way to make those connections, to get your own name out there, to find mentorship. And then emailing people that interest you is going to be huge. I think kind of one of my mentors from my public health training told me that public health or global health is an East Coast sport. And the reason that is because like you think of like Hopkins and you think of Harvard and kind of these where people are located and what institutions they align with and what institutions have been around for longer. And the West Coast, we've definitely like made our name for each other, and we have such strong faculty at universities on the West side too. But if there's somebody that's like not at U of A, email them. They're at a university, they care about teaching. And then also like 1 year is nothing. It's going to go by so fast. Like if you're in your MPH and that's 2 years, right? That's going to fly by before you can even do anything about it. So get started early. So back to my project. So I used photo voice as my methodology, and it's a form of community-based participatory action research. So community-based participatory action research, right? So you are asking a question, you're gathering data, you're trying to figure out what's going on, but that's not where the project ends. The project ends with action. So what you want to do is like, okay, now what do I do with this data? How do I make change? And that change happens at a policy level. So it's really bridging the gap. It's really beautiful, right? Bridging the gap from just kind of research and academia into policy and real world change. And I think that's what attracted me to it. And then the other thing is it's bringing in vulnerable populations to kind of empower them to have a voice in their future and the policies that affect them, and then kind of fostering that empowerment in social change is huge in photo voice. So these are kind of the 3 tenets and the 3 objectives and the 3 purposes of photo voice. One, like we talked about, it's enabling people to think about what's going on in their community, to reflect about the strengths and the concerns, right? Number 2 is to promote the dialogue about it. And you want people from the community, especially people from vulnerable populations, to speak with one another, to talk about their experience, to identify what's important to them. And then the last point is the action, is to now take this to policymakers and make real change. So this is the photo voice path. I think this is a really great graphic. So the way it works is you get a group of people. So for me, it was community healthcare workers that were working in indigenous communities in the Peruvian Amazon that were part of Mamás del Rio. You get them together, you teach them about photo voice, why we're doing this, why we care, how do you take photos, right? Like maybe people have never used a camera before. And then the ethics, right? Like, if you're going to take a picture of someone in your community and then you're going to bring this picture to be published, maybe in a journal or a paper, or we're going to talk about a person in a photo, like what's the ethics behind that? So you have to give really clear ethics training. And then once your group understands what photo voice is, they go back into their communities, into their lives, they take photos. They come together, and as a group, you're discussing the photos. The photos kind of serve as the nidus for the discussion and the focus groups. And then the participants, not only do they discuss, but they're also writing. They're kind of writing about what they see and sharing. It's just a different way to reflect, right? And then you as a researcher also have kind of like a written version of what they're thinking, which is huge. And then the participants kind of choose the photos that are most important to them. You take the photos, you create a gallery or an exhibition or some sort of presentation, and then you're inviting stakeholders, you're inviting policymakers to this final presentation where ideally you have your participants, you have your stakeholders, you have policymakers all coming together, talking about challenges, talking about strengths, talking about future change. So why did I choose photo voice? Images are super powerful, images influence, and people from vulnerable communities should have a voice in their future. And unfortunately, in the world we live in, they don't. So maybe they can show what they see, and we as outsiders or policymakers can learn from that. So a little bit about the design of my project. So I did purposive sampling where we kind of selected the people we wanted in the project. And the reason we did that is because I was working in the Amazon jungle where everything's connected by a river, and traveling up and down the river could be quite treacherous and it could take quite a long time. So we met at the focus groups and discussions happened at a centralized area. So the community healthcare workers, or each participant, had to travel from their community to that central area. So we wanted to choose people where traveling would be quite much easier for them, right? Like I wasn't gonna invite a participant who will have to spend 3 days traveling to that central area, right? It was people that lived closer to the riverbank, people that had participants that had previous experience being in focus groups with Mamá Del Rio. This was not the first project that Mamá Del Rio had been doing. Mamá Del Rio has been established. They've done projects before with the community healthcare workers. So I wanted people that kind of knew how focus groups go. And then I basically ran 2 photo voice projects in parallel with each other. So I talked about how Loreto is divided into districts, which are like counties. So I had 7 agents from the district of Nauta and 7 agents from the district of Parinari. So my total number of participants was 14, but they were divided into 2 separate groups. And I met with the Nauta group separately, and I met with the Parinari group separately. So we, as the research team, would travel between the 2 districts, between the 2 meeting centers weekly, while at the same time, the participants were traveling to their direct meeting point. So the Nauta group never met with the Parinari group during the project. That being said, both groups knew that there was another photo voice group happening at the same time. And I think this is powerful, right? Because we're talking about the experience of community healthcare workers during the pandemic, but like there's a nuance, right? Like if I'm in Nauta, right, I might have different challenges than Parinari because Nauta is closer to the main city than Parinari. So I wanted to account for those nuances, but at the same time, there is a shared experience, and I really wanted to amplify that. Our participants were all from the Kukama ethnic group. So that was just another important thing, thinking about it, putting an anthropological lens on the project. Most of them, I mean, all of them had more than 2 years of experience. Most of them had over like 10 or 15 years of experience. And a good majority of them were vaccinated against COVID. So I'm talking about all these locations and like, where is all of this happening? So here's a map of kind of where I was working. So this is Iquitos. This is the main city and where the main hospital is in Loreto. And then there is a road here, and it's quite a nice road, and it's the same road I was talking about that had the mass graves alongside of it. And from Iquitos, you can drive to Nauta. So Nauta is the name of the county, but it's also a city within the county. So you drive about 2 hours to Nauta. And then once you're in Nauta, now you're on the riverbank. It's a population center. It's a small town. And this is the Marañón River. And the Marañón River meets with the Ucayali here. And here's where you get the start of the Amazon River. So it's kind of cool to think about. And then so we drove here into Nauta. We would have our meetings, let's say, for example, on Monday with the Nauta group. And these were all the communities around Nauta. You had Santa Cruz, San Jose, and each community has one community healthcare worker, right? So the community health worker from Santa Cruz would come travel here for the Nauta groups. And then we, as the researchers, traveled down the Marañón to Parinari, all the way down to Santa Rita, where we would run the same thing on like Wednesdays, for example, with the Parinari group. And then we would travel back up the river. So this river one way is about 5 to 10 hours. You're on a river on a small boat. Conditions, you're dealing with weather conditions. So that's just logistically thinking about travel too is interesting. So the design of my project, so this happened in February of 2022. We did about 4 sessions with each group. So that's 4 sessions with the Nautic group and 4 sessions with the Parinari group. One session was dedicated specifically to training. This training is how to take photos, the ethics, kind of everything we talked about. And that training took 2 days. And then after the training, we had about 2 focus groups on 2 separate themes that I'll get into a little bit more in detail later. And then the last session was kind of coming together to kind of discuss themes in the gallery, which I'll also talk about later. Just because traveling up and down the river is really hard. Participants had about 3 to 5 days to take photos in between sessions, and then they basically had to dedicate 1 full day to travel as well. We had 1 focus group per week, and then WhatsApp was our best friend. So Mamas del Rio, like I said, uses tablets to train and educate their participants and expectant moms. So we were able to use those same tablets for photo taking. So we didn't have to provide more cameras. All of our photos were digital, shared on WhatsApp. People could go back into their photos. I was quickly able to get photos and see what was going on. So that was really helpful for us. And there was some challenges with technology there, like there always is, but it was great for our version of the project. So who is my team? So of course, at the top of my team were my mentors, my Peruvian mentor, Dr. Magali Blas, and my US mentor, Dr. Praniva Madhavanan from U of A Tucson. I had project collaborators. So I heard about photo voice during my MPH. I'm by no means a photo voice expert or any type of expert for that matter. So I luckily was able to bring on a collaborator from the University of Texas, El Paso, whose expertise is in photo voice. Her name was Dr. Ava Moya, and using her for all of my questions to come up, like, am I doing this right? What am I doing wrong? I wanted to make sure this was true to a photo voice. So having her was great. And then also having collaborators from the regional health center and from the government early, right? Like you want to bring these people in as stakeholders because they give you access. You want them to listen at the end of your project. So the only way to get them to listen is make sure that they have a stake in it. So that was really huge. And then having an anthropologist, this is Alexandra, a great help. I am not a native Spanish speaker. I took Spanish in high school. I had to kind of relearn Spanish. So she's Peruvian, she's an anthropologist, a young grad. So again, and I also come from a medical background. So I don't really know much about like, how do you navigate like working with an indigenous community and what's important and what matters. So she was huge. And she also was my research assistant for the whole project. I had coordinators. This is Camilla. She's one of the coordinators for Mamas del Rio. I had no idea like where I was going, what I was doing, what the logistical challenges were. I had never met my participants in the project like before I'd gotten to Peru, right? So Camilla was a really great gatekeeper for me and a really great logistics person. And then for kind of towards the end, I had a graphic designer, I had a videographer, and then I also had a geographer because these communities are not on Google Maps. You can't just be like, oh, like I'm going to Google this community and see how far it takes to get to that community. Like, no, that doesn't exist. So I had to build a map through GIS data and I needed an expert on that. And then all the institutions that were involved, the University of Arizona, NIH, Mamas del Rio, UPCH, which is Cayetano, MINSA, which is the Ministry of Health of Peru, DURESA, which is the Regional Health Directorate of Iquitos, of Loreto, of that Amazon region, and then PAHO, the Pan American Health Organization, which is an extension of WHO in Latin America, it kind of came on in the middle of my project as a collaborator, and they were huge. It was game changing to have them on and to have them invested in the project. So my budget, so what was my budget? I had $10,000 US from Fogarty. And then I got an additional $5,000 US from the Pan American Health Organization. And I was working at an exchange rate about less of $1 US to less than 4 Peruvian soles. So $15,000 is like, okay, like that should be like, that's a good amount, but it goes by fast. Gas is incredibly expensive in the communities. It's about 18 soles a gallon. So, or like $18, excuse me, $18 a gallon. And then, you're also compensating for food, gas, lodging, right? If they're traveling to the meeting center, you got to make sure you provide overnight lodging because it takes 24 hours to travel back to their community. And then just paying my own coordinators, paying my anthropologists, paying the geographers. So money went by fast, which is crazy because like I don't even have $15,000 to my name. So here I am trying to manage it. So this brings me to Pearl 3, is managing your funding. So spreadsheets are your friend. Take a lot of photos. This is an actual photo of kind of an invoice I got from food for the community healthcare workers. Follow up on all emails. Be so nice to the finance people at your institution. I was working with both U of A and Cayetano, right? Because the money was channeled through U of A. U of A had to send it to Cayetano. Cayetano had to open an account under me and under Dr. Blas, my mentor. And then as I spent the money, like they would take and give the money, and it is so stressful. So you want to be nice to everybody. And then a hot take is spending money you don't have. So I did not have my money until March, and I went to the field in February. So I'm paying the community. I'm like, making sure community healthcare workers are paid, that my own lodging is paid with money that I don't necessarily have. So getting creative. Luckily, Dr. Blas had kind of a secondary source of funding completely unrelated to my project, which we were able to use some of that money and reimburse. But that was really scary. And that was a huge challenge. Like, oh my gosh, I'm going into the field without any money, like not real money. So yeah, things like that can happen. Back to the project. So like I talked about, we met twice and we kind of had 2 focus groups, 2 discussions. The first question for week 1 was the same for both groups. And it was, how did the COVID-19 pandemic affect my life and work? And that was kind of the principal objective. But Photo Voice is community-based participatory action research. So anything that comes from the discussion belongs to the participants. This is not the researcher's project. It is the participants' project. So you might go in thinking like, oh man, like I think the closing of the health centers is going to be the biggest thing that comes up. And then all of a sudden, your participants are talking and they're talking about like food insecurity. And you're like, oh, I didn't even like think about that. Well, now the project is going to change in direction to account for what the participants care about. So for week 1, we provided the question. I can get into the details of that later if you guys have specific questions, how we came up with that. So then we presented the question to both groups. Both groups went out into their communities, took pictures with their tablets. We came back as a group and then we discussed. So with the Parinari group, their discussion was a little bit different than the Nautic group, right? Like, even though they're both community healthcare workers in Indigenous communities in the Amazon, there's certain nuances that are a little bit different. So with the Parinari group, the themes that came up and the eventual question they wanted to answer in their second round of photo taking is, what is my work and commitment as a community healthcare worker to promote the health of my community? And Nauta was very similar, but a little different. During the pandemic, what was my work as a community healthcare worker for the health and well-being of my community? So both groups wanted to showcase the value of the community healthcare worker, and that's something that came up really organically in the conversations. But these are not questions that I came up with. This is the language of the community healthcare workers. So then moving on is like, how do you do these discussions? Like, what do you use? What's your framework? So within Photo Voice, the framework is the SHOWed method. And this is a mnemonic, and we did these in Spanish because everything was done in Spanish. That was the native language of all my community healthcare workers. And so this is what they used to think about the discussions. And this was great because this is how discussions were led, and it became very standardized. Like, I come from the medical world where everything needs to be standardized. So this, like, it made sense to me really well too, as kind of managing the project. So the participants knew that they would have to answer these questions of their photos. And the questions are 5 key questions. It's, what do you see in your photo that you're sharing? What is actually happening? How does this relate to our lives? Why does this situation, why do these worries, why do these strengths exist? And what can we do about these? So before we even presented, before we even started the discussions, we gave the community healthcare workers about an hour to fill out these worksheets. And so when they came up to present their photo, because each community healthcare worker had to come up and present 2 photos from their week of photo taking, it allowed discussion to flow really naturally, and they were able to build upon what they had written. So that was huge. So here is a live action shot of me and my anthropologist, Alexandra, leading the focus group with Parinari. They're masking. We're trying to make sure that we're like adhering to COVID-19, but you want to keep the group small. You want to keep it intimate. Luckily, the community healthcare workers knew each other. They were not strangers. So kind of the familiarity was already there. Like me and Alexandra were the outsiders, right? So kind of building the trust over the course with them was huge. This is kind of the Nauta group. We were here in kind of like a church setting here. So that's the other thing, is like, dealing with like, where are you meeting and where are the spaces? And we didn't have electricity, right? So we had to run these focus groups during the day, because when it got night, we didn't have, like, electricity was gone, and like rain and weather conditions. And if we wanted to buy electricity, well, you have to buy the physical gas and then bring the gas to light up the room. So that was just something that I was not going to deal with. So pearl number 4 is be prepared to run. And this is a pearl that my anthropologist, Alexandra, told me when she got a United Nations Security Council briefing from her training in her school. And we think about field safety, we're like, oh yeah, like I'll be safe in the field. Like I know things can go wrong. And then you get to the field and you're like, I did not see this coming from like a million miles. So it's like, how do you prepare and just like be prepared to run, like physically be prepared to run. So I'm going to quickly tell you a story. So my first boat ride between Nauta, that first town, to Parinari, right? I showed you guys the picture of the river. It's like 5 to 10 hours. And these boats leave in the middle of the night, like 3 a.m. So I had never, and they're like a 60-foot like wooden boat with like a tarp. Like we're not talking luxury boats, and they're crammed with people and children and rice and bananas and chickens. Like it is a lively boat. So I get on the boat. It's like 3 a.m. takeoff. I fall asleep at 4 a.m. I wake up and everybody's screaming like agua, agua, and I'm like, oh, that's like a weird thing. So I looked down and there was about 1.5 inches of water on the floor. And I was like, oh, okay, our boat is sinking. This is where I die. And I'm like, like, you're like, was all my life choices worth it? Like, is this how I want to go? Like, I'm going to sink and die in the Amazon River. There wasn't life jackets, right? You can't think like there's life jackets. It's dark. There's eels, there's hippos, there's like snakes. You're like, do I jump in the water and try to swim, or like, do I ride this out? And yeah, just that was like a really scary experience. Luckily, they were able to find where the water was coming from. It was coming from the toilet. They sealed it. But at that point, our boat was waterlogged, right? So like our 5 to 6 hour journey became a 10 to 12 hour journey because of how slow we were going. That was a huge learning experience for me, right? Like I learned that you need a flashlight when you're traveling because it's dark, and flashlights are the communication system of the river. And like, how are you going to show that you're scared, or that's not scared, like stuck or need help? So another quick thing that happened was like, we were on the road traveling and driving, and the road was shut down, and we're like, oh, that's weird. Why is the road shut down? So we like got out of our cab, of our like taxi. We had a driver, and there was a protest happening in one of the communities along the road because of high gas prices. Like that's normal, sure. And then we saw that, the police were there and they were tear gassing and there was rubber bullets. And unfortunately, there was a person who passed away, but there was tear gas. And like, in the United States, police use tear gas here all the time, but I had never had to deal with it. I did not know about how to get tear gas out of your eyes. Luckily, I was okay, but just like understanding like, oh, okay, like what's the protocol for getting tear gas? So making sure you have a kit of like your pocket knife, your pepper spray, a flashlight, a good pair of boots, knowing the culture, knowing the politics, knowing kind of the social situation of where you're going, and seek the information. Like no one told me like what to expect. And granted, I didn't ask. I was like, oh, like what is it actually like? Because you don't really think about it. You just go do it, and then you go do it and you're like, oh my goodness, like if only I had known. So be prepared to run. So back to the project, some key themes I got from the field. So like I said, we were kind of running these two groups, the Nauta group and the Parinaria group, separately, but the themes that came up between groups were very much similar. And both groups knew, right, that there was like another photo voice group happening. So I brought it up. I was like, are you guys okay with combining your work, right, and amplifying your voice? And this is something I asked them. And they were like, yeah, of course. So that was great, because now I'm working with double the amount of data, double the amount of transcription to support a theme for whatever political action I want to take. So the themes that came up from the field, answering kind of the question of how did COVID-19 affect my life and work as a community healthcare worker, we had education, transport, care, sadness, medicinal plants, health, the community medicine cabinet, which is kind of like this box, this like literal 2x3 box that's kept at somebody's house in the community that has very basic meds like ibuprofen, Tylenol, maybe some blood pressure meds, maybe a little bit of first aid. So that came up, the importance of the community healthcare worker and vaccination. And this like beautiful graphic was done by the graphic designer, again, talking about the people on the team and who was important and what I needed. So this is kind of an example of the final product. So the photo here was taken by Melissa from Nauta, and the text is by Melissa and Jeanette. And when I say that is we took Melissa's words from her showed worksheet that she wrote. We went into the transcripts of the actual focus groups. We recorded everything, and we kind of highlighted like, oh, this is like really important, and like, right, like this is written for policymakers. So what's the language of policymakers? How do we get our point across? So really using the language of the participant, and with their permission, modifying the language so it kind of fits your need. So we told Melissa like, hey, Melissa, like we love what you wrote and we love what you said, but Jeanette also said some really cool things during the discussion. Do you mind if we kind of play with your words and create a caption for the photo? And everybody was like, yeah, of course. So I have the text of the caption of what's happening in English at the top, and then the Spanish, the original, and at the bottom. And this is because we're English, primarily English speaking audience. The title is The Children Study at Home. That's in English. The second line is Los niños estudian en casa, which is the same thing in Spanish. And the last line is the title and comma. Like, again, thinking about like, okay, this is community-based participatory action research. How do I amplify the voice of vulnerable communities that usually don't have a voice? And I'm working in Kukama communities, this ethnic group in the Amazon. So we wanted to make sure that the voice belonged to the community. So Kukama is like a language as well. A lot of the all of the community healthcare workers, none of them actually spoke Kukama, but they wanted to make sure that that language was represented. So that was a touch that came from my anthropologist, again, thinking like, I would never think that, but that's like a very anthropological way of thinking of presenting work. So I was really happy we did that, and they loved that. So kind of now getting into the theme. So the theme of this photo is education and how the schools shut down secondary to the pandemic, like they did here in the US, and the children had to study at home, but that created a burden on parents and lowered the quality of education, and how this was a struggle. Another theme that came up was transportation. So these are the boats that the community members use to kind of travel up and down the river. They're like kind of small wooden boats. And what's happening is it's like symbolic because the boats are in the riverbank and they're not being used. So here, when like we shut down because of pandemic and we're like, don't leave your house, we were kind of talking about like, you don't leave your house because you don't want your family to interact with another family because that's how you'll spread. So here in this region, we're talking communities, right? So if you live in community A and you have a family member in community B, like they didn't want travel between community A and community B. So the isolation wasn't happening within community A, it was happening between communities. But that was also huge, right? Because like, how are you going to go to the city and sell your fish, sell your, whatever goods you had and make money? How are you going to travel to your farm? So that was huge for them. And you see, even it was a little boat that fulfills a great function in our daily life. Another thing that came up was care. That was another theme. And here there's a photo of social distancing and kind of complying with the state mandates. And that was, again, like the role of the community healthcare worker was to educate people on these state mandates. And what you see is like, for the most part, like in the beginning, like whether these things were adhered to was very community dependent. But there was knowledge, right? Like social distancing, that's not something that existed before COVID. Here we're talking about the theme of sadness. So what's happening in the photo that Delicia took is that this woman is sitting outside her mother's house, and her mother passed from COVID. So she talks about how the daughter goes there and sits there kind of every day and cries, and the sadness and the sorrow that was felt in the communities. And like, while the cities were being absolutely devastated and they had huge death tolls, the communities, what we found was it wasn't like the quantity of deaths, but you have to think about like, okay, if this is a community with 70 people, maybe 80 people max, 1 to 5 deaths is going to be felt really, really heavily, right? That's like a big part of your population. So that was something else that came up. The role of medicinal plants. So what came up again and again and again was how medicinal plants were the strength for communities during COVID-19. And we're in Quito, like we're in Loreto, we're in the Amazon, one of the most biodiverse areas of the world, with these individuals that have generations of knowledge on how to use these medicines. And why they were such a strength was because there was a lack of pharmaceuticals. Like they weren't even getting Tylenol to break a fever. So what do they rely on is kind of these remedies that have been passed down, and new remedies that were created for COVID, a lot with like lemon and ginger and kind of these like other plants. And so what you see here is Fauper, one of the community healthcare workers, standing in his garden, and he's like beautifully labeled all of his different plants for us. And something else that was really interesting was like, this is knowledge that we have as community healthcare workers here in the Amazon, but we need to share this knowledge with the world. Like everybody needs to know about the power of these plants. Here is the health. It's a picture that Segundo took of the health post that was closed during the pandemic. So it was kind of like, we need to work with the Minister of Health and the regional health director to talk about like, where do we get health if the health post closes? Here we have Fauper again, the medicine man, dressed in his PPE, and he's showing how he visited patients or mothers during the COVID-19 pandemic, and the knowledge he was able to share. And here he talks about how he's not paid. Community healthcare workers aren't paid, that this is all voluntary, but he does it because he cares so much from his community. And he kind of talks about the fear, and here he says like, I am no longer afraid of death, and kind of the importance of the community healthcare workers making these home visits. Vaccination, another big theme that came up. And the reason that here we have Jeanette showing, recreating, getting vaccinated. And the importance of the community healthcare worker is like, okay, the vaccines arrive. Who are going to be the first group that gets vaccinated? when hesitancy is there, right? So the community healthcare workers were very much role models and being vaccinated against COVID, and then showing the community and educating the community that like, hey, like vaccination is a great preventative method. It's not going to turn you into a zombie. It's not a chip. It's not going to make you sterile. So that was huge. And then here we have that medicine cabinet I was talking about earlier without medicine. And so here you can see there's like barely 3 bottles left. And my favorite line that came up from the discussion was here from Marta of Nauta. And she says, as an agent, I feel worried because it is empty. The medicine cabinet is empty. It is like a soldier who goes to war without weapons. So while we talk about those like medicinal plants being huge, it's not like the communities didn't want pharmaceuticals, right? It was like Western pharmaceutical medicine was seen as complementary, and those two complementary to the medicinal plants, and they work together to heal. So that was huge. So the results, the overall results, we have all these themes. We kind of categorize them into 4 major themes: the collapse of social infrastructure, which is the education system, the transport system, and the health system; the use of medicinal plants versus pharmaceuticals and how they complement each other; interesting comparing how medicinal plants were a strength and pharmaceuticals were a huge weakness during the pandemic; community adaptation strategies and struggles. And by strategies, I mean kind of the social distancing, the masking, the hand washing, and the struggles of like the collapse, the economic collapse, like people couldn't go to their farms, and like death and dying of family members and loved ones. And last is the importance of the community health agent. And that's kind of seen through the lens of vaccination, and that these individuals are role models. They are making home visits. They are trusted in their communities to make health decisions. And like, how do we leverage that, right? So the call to action is the last part of the Photo Voice project, and it's what you present to the policymakers. And this is what came from this is the actual language of the community healthcare workers. And what they want is integrate community healthcare workers into the formal health system of Peru. And by integration, it's compensation, right? We talked about how it's already voluntary. Training community healthcare workers in more topics, right? There's no standardized training. Community healthcare workers were not ready to handle the pandemic. They were not trained in it. So who's going to train and how are they going to train? And then strengthening the system of the community medicine cabinet. So the conclusion of the project was, by integrating community health agents into the formal system of Peru, the health system could be better stabilized to handle future health catastrophes. We did 2 galleries. I know we're coming to a close, so just really quickly, we did 2 galleries to kind of show off the work of the community healthcare workers. One of them was at the regional health offices in Iquitos, and that's one where we were able to invite all the community healthcare workers to show their project and to show their gallery. And one was at the Ministry of Health. We had collaborators come to these, we had policymakers come, and we had one conference that was through the health insurance of Peru as well. That was more for like academics in Peru. So we invited people from the regional health offices, the regional government, Pan American Health Organization, the Ministry of Health. There's like a whole section in the Ministry of Health devoted to community healthcare workers. They were involved, they came, they saw, and then other NGOs happened to be there. And what was really nice is we timed these galleries with the week of the community healthcare worker. So the first, or the day of the community healthcare worker, I believe, is June 4th. So that was kind of like, we wanted to have the galleries ready. So there is incentive from the government to show off the work because they're celebrating community healthcare workers already. So we're providing them with content. So that just worked out really beautifully for our project. Here are all of our lovely community healthcare workers. That's Dr. Blas, that's me. They received a certificate from the regional health offices for their work. This is them and their gallery in Iquitos. This is the gallery. This is the presentation that happened at the Ministry of Health. And this was kind of done in an auditorium, and it was done over Zoom. And there was about 800 people over Zoom. So while the room wasn't that small, we reached a lot of people, and we had quite a good turnout from the government that came, which was cool. this is me and Dr. Blas, we're presenting, and just kind of this, she's another community healthcare worker from Lima who is really interested in the amplification of voices from other community healthcare workers. So, you know, it's cool because like now you've inspired community healthcare workers in another area to kind of take control and do their own thing. Dr. Madhavan was able to come to Lima for the presentation, which was huge. We were able, like, what's important is giving back to the participants. So we created a photo book for all of the participants, something hard copy that they can take back and be like, look at what we created. This is so cool. And we were also able to give this to the collaborators. So it's like the traveling gallery. We created a video. We created 2 videos. So this is Jefferson, and where we interviewed kind of the community healthcare workers, and we put the call to action in a video format, and which is great for policymakers. Like they're like, hey, look at this cool video with like all this great music, and like, isn't it so exciting? And it's a quick way to show what you care about. So my project is not done. I am back in the United States. I'm currently in San Diego. I am still needing to finish up my manuscripts and send those in. I'm trying to do 2. I want to publish the album, get a ISBN through the National Library, and probably I would love to be able to do another gallery here in Arizona. So my last thing is fake it till you make it. So learn by doing. Global health is hard. Email people that are smarter than you, have your mentors connect you with people. Like I said, it's a really small world. I had no idea what I was doing most of the time. Probably all of the time, I was just like, I'm just going to do this. And there's no right way to do things. You're going to fail. And I think like being okay with failing is okay. It's like empowering and freeing to know that. Know your weaknesses. Like for me, like Spanish wasn't my first language. I had a lot of challenges with my IRB, a ton of challenges with getting my funding, and my project changed. Like the COVID-19 pandemic happened. I went in, I received the fellowship thinking I was going to do a different project, and the pandemic happened, and the needs of Mamas Del Rio changed, and the needs of the community changed. So then my project changed. And the last is like project moves slow, and that's okay. Like we're used to working on an American timeline of like, I send you an email and I expect an answer in 24 hours. Other countries don't work that way. And accepting that timeline is huge. And that is also, again, really empowering and really freeing. Like Peru is a Catholic country. Nothing is going to happen between December and February because the country shuts down for Christmas. So like knowing that like, oh, okay, like that's probably not a month where I want to do things, because that's probably a month where I want to write, because, you know, there's not going to be as many resources. So this is a video that we created. I can send a link later. And I just want to dedicate this this presentation to Jeanette. She's here, one of the community healthcare workers. She was huge, really passionate. Unfortunately, she passed. So just a little shout out to her. Thank you guys so much. I'll go ahead and take any questions. And I have my email here. If you guys have more questions or about anything and you want to email me separately, please do. So thank you, everybody.
Thank you so much for the wonderful and informative presentation. I really like that you addressed the academic aspects as well as the logistic and safety issues. And I believe that it would be really useful for students who are interested in applying for those kind of programs and also doing some field work. Now we'll open up for the questions. So you can unmute yourself or you can put the questions into the chat.
And I see Dr. Bloss on the call as well. So if you guys have questions, I'm sure she'll take them. She was an excellent mentor, and she can, you know, answer, probably talk about things too. And I see Alexander, who is my anthropologist on the call, could also probably talk to about the project as well.
Okay, okay, Lisa, do you have any question?
No, I just wanted to say real quickly, Tina, your project is amazing. I think you did a fantastic job. I'm really impressed by everything that you and your team did. So I just want to give a shout out and just say how wonderful this all came together for you. And I'm very happy for you.
Thank you, Lisa. It's so good to see you. Another Fogarty recipient.
I also want to add, so I am Magali Bless, that I think one of the amazing things about Tina is her focus. She was very focused along all the way until we have the results done and the project was a success. And I want to add that we just presented at another gallery, so the gallery of her work at the second international encounter of community health workers that happened in Peru last week, with where Brazil, Ecuador, Bolivia, Colombia, and Suriname were present. So her project is also helping community health workers until now. And I hope that they will continue in the future. They were so empowered by the project that, for example, now they form the first association of community health workers, or Amazonian community health workers. So they want to establish like a community so that they can ask for their rights. So yeah, we are proud of you, Tina.
Thank you, Dr. Blas. I love to hear that the project is still making impact. It's awesome.
So now I'm mindful of the time. So I think, Rosanna, you can take away.
Yes, thank you. On behalf of the Global Health Institute and MESCOP Global Health Programs, thank you, Tina, for your thoughtful presentation and for your commitment to global health. And to our audience, thank you for joining us. Please visit the Global Health Speaker webpage linked in the chat to view past lectures and upcoming speakers. And plan on joining us next month on Thursday, November 17th to hear from Lisa Lavita Woodson. Information for the Global Health Equity Scholars Fellowship Program is also in the chat. And I will mention, since we have Dr. Blas with us, on our YouTube playlist, we actually have her presentation. She joined us during International Education Week last week, and we have that posted up on our YouTube channel as well. That is linked out from that Global Health Speaker webpage. So thank you, everyone. Have a great afternoon. We hope to see you next time. Thank you.